I'm Dylan Black. Let's find out about the Clinical Exercise Physiology Lab that takes place at the University of Ottawa. Joining us right now, we have Lara Pilutti with us, assistant professor. Should I call you Ms. Pilutti?
Lara's fine.
Lara, okay. And Thomas Edwards is with us as well, PhD candidate. You're both at the University of Ottawa.
That's right.
And welcome here. What are you a candidate in? What field?
So human kinetics.
Okay.
So human kinetics is kind of study of how the body moves, what happens during the body during exercise, and our lab kind of focuses on how to use exercise as almost like a rehab method for some people with their clinical population.
Okay, so let's talk about that lab, Lara. Who created the lab initially?
Yeah, so the Clinical Exercise Physiology Lab is part of my research program. We've been established at the University of Ottawa for about 2.5 years now, and we were originally down at the University of Illinois before coming up here.
Okay, now you're focusing on MS, multiple sclerosis.
That's right.
Now why exactly that condition?
Yeah, so we've been really interested in applying exercise as a form of managing chronic disease. I started some of my training looking at spinal cord injury and found that we could use some of the same interventions and adapted forms of exercise and apply that to people with MS.
Okay, so can you tell us more about MS? I mean, how does this affect people?
Sure. So MS is a chronic neurological condition. So essentially it manifests in various different ways. So most people with MS are affected by problems with mobility and walking, visual impairment, sensory dysfunction, so a variety of different things, and really everybody with MS is affected differently.
And how many Canadians does it affect?
It affects just over 100,000 Canadians.
A lot of people, so that's why these labs are important.
That's right.
So the benefits then to exercise, Thomas, for those who have MS?
Yeah, so I mean, exercise is one of those things where you hear about how great it is all the time for not just healthy populations, but populations like MS who could maybe use it as a rehab modality, or rehab therapy or something like that. And what's great with MS is it's been shown to improve things like mobility, physical fitness. It's shown to combat some of the symptoms that they experience, as well as some things like depression and anxiety have shown to reduce with MS or with exercise. So it not only helps them physically, but also maybe from a neuropsychiatric point of view as well.
Okay, Lara, are you looking at other conditions through these labs at this point, or are you primarily focused on MS?
We're primarily focused on MS. We have done some work with other collaborators looking again at patients with spinal cord injury, but right now our primary focus is MS.
Okay, so FES is functional electrical stimulation.
Yes.
You guys are so smart. I need to be on my toes here for this, okay? So what exactly is that, Thomas?
Yeah, so we actually brought in an FES bike to kind of demonstrate what it is, but basically it's a piece of exercise equipment that allows people who might have trouble using their muscles exercise fully. So what it uses is it uses electrodes on the skin, and these leads here that lead into the bike actually provide almost like a little bit of a shock to these individuals. Now, it's almost like a rehabilitation method where it causes the muscles to activate and helps them basically maximize how much they can get out of their exercise. So as they're cycling, this little bit of electricity, a little bit of stimulation helps bump up how much they're using their muscles and hopefully how much they can improve after exercise.
Okay, so you are going to give us a demonstration. You're not going to do any cycling, but you're actually going to take the shock first here on TV?
Yeah, so it's very, very light stimulation, but what it does, so again, these are placed on all the muscles, or some of the muscles in the lower limbs, so I'll do my arm just to demonstrate.
Okay.
But as you put it on, these leads are specific to each muscle. Now, this is important because as you're cycling, they're activated in a pattern, right? So it's not like it's just free fall, kind of shocking. It's actually activating the muscles in a pattern.
Okay.
So I won't actually zap myself today, just for the sake of time.
Okay.
But what you do is you place these electrodes into the leads, like this. Goes on the muscles, and again, these are focusing on the lower limbs. As they go in, each lead, so as they're exercising, so let's say I'm doing something with my arm, if I'm lifting like this, if I can only get to about there by myself, the electricity will actually help me get the full range of motion. So if you imagine that's coupled with exercise, they can get more muscle activation and hopefully more benefits with exercise. So that's basically the idea, is these electrodes help increase the amount they can exercise.
Now, I know you said you don't want to do it because of the sake of time. We still have a minute and a half.
Yeah, I can.
No, you don't have to shock yourself.
Yeah, I mean, it's not. That's. I think I want to stress. It's not like a shock. It's more like pins and needles.
Totally.
It's basically there to help activate the muscle. So it's not painful. We've had a lot of participants who actually enjoy the sensation. So it's not a painful stimulation. It's more just a additive effect.
Okay, so Lara, about 2.5 years into the study, this lab, I mean, how has it benefited people so far that you've seen?
Yeah, so we've primarily focused on people with MS who have more limited mobility, so like using this FES cycle as well as other modalities. So focusing on these adapted exercise interventions. So we've seen some benefits for symptomatic outcomes like reducing symptoms of fatigue that people with MS are very severely affected by, improving mobility, and then just functioning in everyday life.
Okay, and 30 seconds, you've got an open house coming up?
That's right, we do. So in about a month. So March 2nd from 1 to 4, we're going to have an open house in our lab. So people can come and check out some of these different tools and adapted exercise that we have and learn about some new studies that we have going on.
All right, thank you very much. Good work right there, Lara and Thomas. We appreciate your time.
Yeah, thanks
so
for having
much.
me.
Thank you. Much more daytime coming up in moments on Rogers TV.